Hello everyone, today we are going to see about eye irrigation. I am Mrs. Golden, working as tutor in M College of Nursing. So the objectives are, what is eye irrigation, what are the purposes of eye irrigation, the articles required for eye irrigation, the types of eye irrigation, and finally the procedure for eye irrigation. Coming on to definition of eye irrigation. So eye irrigation is nothing but the process of washing out the conjunctival sac of the eye by a stream of liquid. So this eye irrigation, it involves by pouring or inserting the liquid into the eyes or the conjunctival sac of the eye to flush out or to remove any foreign object that is present in the eyes. So coming on to the purposes. So purposes are to remove any foreign objects like dust or dirt or any other particles which is present in the eye. The second purpose is the flush out of the chemical irritants. That is, the chemical irritants are any acid or alkaline substances that have been get into the eye and causing a chemical burn can be able to be removed. The next purpose is to treat the inflammatory conditions. So the inflammatory conditions like conjunctivitis, that is, we can say it as pink eye, or any other inflammatory conditions can be able to be treated. The next, to apply medication. So to apply medications are lidocaine or any other medications that can be used during irrigation. To apply heat or cold, that is, if there is any pain or swelling in the eyes, as a remedy to apply heat or cold, this eye irrigation can be used. So the articles that is required for eye irrigation are a clean tray containing the prescribed eye irrigating solution. That is, what solution is needed, that solution we can use. It can be either a normal saline or any other irrigating solution can be used. Next, a pair of clean gloves and irrigating syringe, towel, a kidney tray or the paper bag, and the medication card. So irrigation can also be used with any other additives like lidocaine. So lidocaine, why we are using is to reduce the pain during irrigation, or especially if there is any chemical burns or any severe injuries in the eye. As a local anesthetic, this lidocaine can be used. And next additive is the any other medications. So medications like antiseptics or antibiotics can be added to the irrigating solution and it can be used. It is used depending on the severity of the or any specific injury. Next is the irrigation with saline or sterile water. So most probably we are using the normal saline, that is the saline solution. So this is most probably preferred fluid for the eye irrigation. So normal saline is isotonic and it has the same salt concentration as the eye to prevent irritation and damage to the eyes. Next is the sterile water. If normal saline isn't available, at that time we can go on for the sterile water. So sterile water can be used as a substitute. However, it is crucial to ensure that it is sterile to avoid any infection to the eyes. So next, coming on to the procedure. So in procedure, the first and foremost step is to check the doctor's order and the type of solution that is to be needed for the irrigation. And the amount of solution is very important. Next one, explain the procedure to the patient. Assemble all the articles that is required for the irrigating solution along with the irrigating syringe. So before starting your procedure, you should wash your hands and make sure that the temperature of the irrigating solution is approximately same as the body temperature. And assist the patient to tilt the head towards the side of the eye to be irrigated. Why means, if you are tilting the head towards the side which eye is to be irrigated, so when pouring the solution, it can come out of the eye easily when it is tilted to one side. So place a protective cover over the shoulder and neck and also hold a curved basin, that is the kidney tray, on the cheek of the affected side and expose only the lower conjunctival sac and hold the upper lid with non-dominant hand. And next is, you have to hold the irrigating syringe about 1 inch from the eye. It should not directly touch the eyes because it may cause injury. So you should hold the irrigating syringe 1 inch above the eye, from the eye, and directly you should flow the solution gently from the inner canthus to the outer canthus along with the conjunctival sac. and you should be very careful while doing the irrigation, and you should not touch any part of the eyes with the syringe. Clean the area after irrigation, and you should document the procedure what is to be done. So this is a pictorial representation of the procedure. That is, before starting the procedure or before irrigating, you can check the pH of the tears of your tears using any universal indicator paper. So this is the tubing clamp to control the flow of liquid. While irrigation, you can control the flow of liquid with this clamp. So this picture represents that is, you should position the head which eye is to be irrigated. That side you can tilt the head and you can place the kidney tray under that. So this picture represents that how you irrigate the eye, that is from the inner canthus to the outer canthus. So while you are irrigating, if the kidney tray is placed under the affected eye, the solution which is irrigated can be flown down easily into the kidney tray so that your linen or your dress cannot be spoiled. So next one, coming on to the important considerations before irrigating the eyes. If there is any case of chemical burns, prompt irrigation is very crucial, and you should choose the appropriate irrigating fluid. So the type of irrigating fluid can vary, so appropriate irrigation fluid is very essential, and in some cases local anesthesia can be used, that is the lidocaine. And after irrigating, the eye should be examined by the healthcare professional. That is, if any foreign object is present, means after irrigation whether the foreign object is removed or not. That is, you have to ensure with the healthcare professional. And next one, eye irrigation is a very standard procedure, and it can be used in emergency rooms and also in the eye clinics. And some individuals may also experience a temporary vision problems or discomfort. So you can educate the patient regarding this. If after irrigation you may experience some vision problems or any discomfort can be present in the eyes, like that you can educate the patient after the eye irrigation. Thank you all.